The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hi, everybody. Dr. Tom Roselle here. Welcome to Ageless Health live stream, and we have a great program. Hope you joined us just a minute or so ago on Dr. Tom Roselle Live on WMAL 105.9 FM in the Washington metropolitan area. We're going to continue the conversation just a little bit, maybe a little differently than we did just a minute ago, but things that you need to know about. Your body has an amazing capacity to regulate all kinds of things in a state of health and dysfunction. But what we're talking about today is we're talking about, those periods of depression and anxiety that you get and where they really can come from and why they come from there. There's a tremendous amount of studies that have been published over the last several years, particularly Harvard Medical, Loyola Medical, Cleveland Clinic, and the list really goes on, but those are some of the top ones that are out there. So what I want to cover today is how your intestinal tract can regulate the highs and lows of life, the anxiety periods, the depression and so forth, and then some of the things that you can do about it. And by the way, if you go to drtomroselle.com, there's a couple things I'm going to direct you to that will help detoxify systems and make them better. Beginning stages, if you will, that you can do something about. So having said that, we're going to get into the program just a little bit and talk to you about, that gut feeling, if you will. So it's kind of interesting when you start picking the puzzle apart, so to speak. We're talking about the gut terrain. What I mean by that is the intestinal tract has all these good guys and all these bad guys. We're going to talk a little bit about the good guys when they're present and how they repair and restore and make you feel better emotionally. And we're going to talk about the bad guys as well and how they depress and can cause these things that we're talking about relative to depression and anxiety. Now, when we deal with the intestinal system, it's really important to understand the intimacy, the interrelationship, if you will, of all of those things in the tummy. That gut feeling that you have, well, it's been known for years to pay attention to it. And when it's not working the way it's supposed to, your intuition, your third sense is off. Well, here's what it's all about. Health of what we call the microbiome, those little bugs that are the good guys in your intestinal tract, affects your overall body health. That's number one. We know that science has shown that repetitively over and over and over again. Something as simple, if you have an abnormal bacterium that's in your gut that's setting up housekeeping, even a strep infection or staphylococcus or an E. coli that's out of control or a mutant form of that, your intestinal system can really give you all kinds of interesting symptoms, if you will. So this gut health that's affected by the microbiome of our body affects everything. So we'll start with that. They can affect the brain. And in fact, they're a key player in anxiety and depression. We know that to exist. And you can go to psychologytoday.com/US/blog, and you'll see very specific scientific articles on this. They affect the brain and the perception of things, misinterpretations if they're not working the way it's supposed to. It's important, if you want to maintain good mental health, to maintain a healthy intestinal tract, period, end of story. Things by eating healthy foods like unadulterated, non-GMO, organic foods, rich in fiber, exercising regularly to get rid of the waste, and make sure you're not constipated, make sure you don't have an unhealthy gut the other way with diarrhea and so forth. But we have to understand that that's the center of health. Why? Because based on the research and based on the authors, they'll all agree that at least 75 to 80% of your immune system is in the intestinal tract. And it controls about 80% of the production of these little guys called your neurotransmitters. They're agents that stimulate the expression of other pathways, such as things like serotonin and dopamine and GABA and taurine and theanine and so forth. And it goes on. So when you understand that, you understand what these guys do interconnectedly. You have to understand that this intestinal tract, if everything that I'm telling you is true, which it is, has a huge impact on your mental and emotional health, as well as your physical health as well. So we're going to talk a little bit about, managing anxiety a little bit today based on your gut health, but we want to get into it just a little bit more. And we wanted to talk about the influence it has and the subtle, if you will, step-by-step breakdown of I don't feel good. When you were a kid, you felt great, right? You had a lot of energy, you had a lot of push, things kind of rolled off your shoulders. Most of us, obviously there's exceptions to that. But all of a sudden, as time goes on, we don't adapt the way we did before. We don't have the lightness. So let me explain what that really is. And, I want to look at a couple of things here just to make sure that I'm really on point with you. The gut axis indeed influences anxiety and depression. So hidden within the walls of this digestive system, we're going to call it, because that's what it's called. If you look it up, it's called the second brain. It's called the enteric nervous system, ENS. So digestive system, second brain, enteric nervous system. So unlike this thing, this big brain, this mainframe, this computer that sits in between your earlobes, unlike that, the enteric nervous system can't balance your checkbooks. It can't write love notes and compose music or poetry or anything like that, but it plays a huge, crucial role in controlling digestion from the time you swallow something to the time that you eliminate it. Now, there's a whole bunch of recent research that is quite interesting, and it shows the connections between the enteric nervous system and the central nervous system. Central nervous system is your brain, your spinal cord. You have 31 pairs of nerves that come off it. That's called the peripheral nervous system. And it's one of these things that triggers reactions throughout the system. So if the enteric nervous system and our central nervous system have an irritation because of that gastrointestinal system, it can send signals back to the brain, triggering mood changes. So, in fact, people who have irritable bowel problems or colitis and so forth, and functional bowel problems of constipation and diarrhea and so forth, bloody stools and so forth, in fact, often experience emotional shifts that are not who they usually are. There's evidence that anxiety and depression may influence gut health in the other way around. So you can go back and forth. So if somebody gets into a stinking thinking, if you will, state where their mind is going into a negative feedback cycle, then what shows up is anxiety that is triggering this bad intestinal tract problem. All of a sudden you get cramps. All of a sudden you get a little, constipated. All of a sudden you get diarrhea. In the medical community, they know people that, you've heard the term anal retentive. Well, it was expressed for a reason. Holding back means that you're not expressing things that are going on. And that all by itself can cause not only gastrointestinal problems, but then reverse cause the problem to get worse when it comes to anxiety and depression. So here's the exciting part when it comes to the publications that are out there. Therapies that help one of the brains, if you will, we said the second brain is the gut, can have a tremendous impact on the other. So here's for an existence, and I'm not a drug guy, you all know that. Certain antidepressants can calm the gut symptoms by acting on the nerve cells in the intestinal tract and psychological interventions like cognitive behavior therapies can improve communication between this guy, the big brain, and the gut brain. So the primary brain and the second brain. So taking care of the intestinal tract, the gut health, if you will, the microbiome, may be just the thing that you need to regulate and treat your moods, your anxiety, your depression, your agitation, your emotional outbursts, and things of that nature. So if we want to explore this, we got to know a little bit more about that enteric nervous system and what it really means and what it really does. Now, I want to just kind of do a sidebar at this point. I want to remind you of something that's coming up. Two things, actually. Those of you in the Mid-Atlantic area here at the Roselle Center, or near the Roselle Center for Healing in Fairfax, Virginia, we've got two dates that are coming up. First, the 10th, coming up in about a week and a half or so. I'm going to be doing an in-house program. I'm the guy that's going to be there on what we're talking about. We're going to be talking about gut health. We're going to talk about the brain-body connection. We're going to be talking about digestive problems of all sorts, but more importantly, what you can do about it. And I'd like to invite you to, if you're in the area, please come. All you have to do is, it's our way of giving back to the community. We do it in cooperation with a foundation called Caring for Others, but join us. But we have to make sure that you understand that we have limited space and we can only hold up to a certain number of people. So please register. You can do that by going to rosellecare.com or drtomroselle.com. Either way, old-fashioned way, phone number 703-698-7117. And that's coming up on the 10th. Now, we also have a Women's Day that's really exciting, and that's going to be on the 21st. Really cool time. You're going to learn about flower essences. You're going to learn about thermography imaging. You're going to learn about women's health. And guys, I'm sorry you can't come, and I won't be there, but you're going to have people like Dareth Painter, who's a head thermographer, and she's a wellness coach, and she's specialist in fluorescences. Dr. Stephanie Pina will be there. Sybil McFarland. We're gonna have a group of women who really can walk you through this and show you, ladies, what is right for your health. It's gonna be fun. You'll get to see some of the other things that take place. But again, that'll be at the Roselle Center in Fairfax. It's a Saturday afternoon, or no, it's a Sunday, I think, all day. But anyway, you'll find it's online. Go there and register and let us know that you're coming. Please be our guest. I promise you it'll be a great day. I wish I could be there to meet you all, but unfortunately, they won't let me come. They told me I had to stay home. So we'll meet another time. So you can meet me on the 10th and join the Women's Day that way. But either way, you can go to drtomroselle.com, or you can go to rosellecare.com and find more information on either one of these subjects and register accordingly. Let's get back and let's talk a little bit about this craziness, this gut-brain connection, and what happens with the enteric nervous system and how it changes the gut environment and the nutrient levels and the pH levels and so forth. So there's this thing called sensing and perceptive reflexes. And that's a real terminology. If you go into the psychological literature, you're going to see that. And it says neurons in the enteric nervous system, that gut, that intestinal tract, detect changes in the gut environment, the flora, right? These good guys and these bad guys, the mold, the fungus that often lives in there. So it also has a sensory perception of nutrient levels, the stuff that you need to have there to support good health, the pH level, the acid-base level of that gut. And it initiates different responses and reflexes based on those sensory perceptions. And it releases certain enzymes and adjusts the blood flow to the gut, and it increases the mucus secretion. It upregulates something called IgA antibody response, which is produced by the mucus patterns from your mouth to your tail end, right? And everything that's in between. So this is really an interesting, complex situation. The enteric nervous system, the gut, communicates bidirectionally with the central nervous system, your brain. And how does it do that, might you ask? It does it by something called the vagus nerve, which, if you've listened to me over a period of time, I keep going back to that because that's the kingpin in the nervous system as it directs everything else from the brain to the rest of the body. It's the 10th cranial nerve. It goes down, it touches the lung, and it touches the heart and the stomach and the intestinal tract and all the way down to the bladder. And it tells it and regulates it and tells it what to do and so forth. So if that's true, then a disruption of the neurological output from the brain to the rest of the system could also cause a problem. So how would that be disruptive? Well, if you had an injury, you had trauma, you had a car accident. I've had patients who've come in over the years who have had a car accident, and the symptoms they have now is bad intestinal tract and bad digestion, and they're on all kinds of things to regulate acid balance and so forth in the intestinal lining. They get suddenly they're constipated or they have other problems as well. That communication, that back and forth between the enteric system of the gut and the central nervous system, the vagus nerve, the 10th cranial nerve, is really an intimate pattern that we know a whole lot about today that we didn't know years ago. And by fixing one, often you can fix everything else. So they feed back to each other, back and forth, back and forth. Digestion and motility is regulated by the enteric nervous system. So again, going back to the constipation pattern, right? So it functions in digestion. And by the way, peristalsis, the movement from your mouth to your butt, is peristalsis. And it has to make sure it's moving it through rapidly, because if it doesn't, it sits there, it stagnates. Then you have all kinds of other very toxic things that will affect the body. It'll affect your brain. It'll cause inflammatory reactions. It stops the communication of these neurotransmitters and the work that they're supposed to be doing. So this enteric nervous system and the central nervous system are truly interconnected. They are interconnected because if there's any inflammatory reaction in the gut, it can cause a problem. So if you get a problem where you have injury to the brain, it can hyperstimulate that vagal nerve, causing increased inflammatory response in the intestinal tract. It's important that you understand that a drug doesn't necessarily fix the underlying problem, that you have to find out what the problem is, whether it's the central system or it's the enteric system, what happened to it. Is it a biochemical irritation that took place, or is it trauma? What caused it to occur? Once you know that, now you can direct treatment. So there's a lot of therapeutic implications, if you will, that will make life a whole lot better for you. Something as simple as digestive enzymes and good probiotics. It'll make it happen. If the system's toxic, we're going to get into it. I'm going to tell you what you can do about that. So if you have a therapeutic indicator, something that you have to do. So what are you going to do? How can you handle this? How can you fix the gut? Something as simple as go exercise. Something lightly, go for a walk. Have you ever seen an Asian, when they exercise, an older couple perhaps, they walk outside every day slowly in the morning. They have gentle movements. They may participate in something called Tai Chi. And they're getting energetics moving in their body. They calm their system down. They're making things become more gentle, if you will. So just doing those things, cognitive shifts, catching yourself in a bad meandering, stinking thinking, as I said before, and simply using the word stop when you catch yourself, stop, and you're reprogramming, you're rechanging what you do, how you think. That often is enough to affect everything that you may be suffering from. And we're going to talk about a couple other things that you can put in your system. So let's talk a little bit about how stress affects the nervous system, because stress is a killer, right? It's the number one thing that takes all of us out. So stress, it can be from anything. It could be something gentle that you don't perceive the way that you should, but the organizational piece of the gut first, the good microbiome, good mucus, it allows for decent communication. It produces all the IgA antibody responses and so forth. But stress and the enteric nervous system, stress doesn't just play mind games in the body. It also, as we said earlier, influences that intestinal health. So let's see what we can do and look at what really happens in that whole system. So when you're under stress, no matter what it is, the swallowing mechanism in your throat, it's called your esophagus, may contract involuntarily, and it can cause pain. It can cause pain in your chest. It feels like a heart attack, but that's not what it is. That can come simply from stress. It also can come from the nerve roots in your neck called the phrenic nerve, which goes all the way down and it attaches to the diaphragm, not allowing that to work. And subsequently, it doesn't help as it should in peristalsis. And you can have a problem. So there's things like that. Spasm and acid, that fight-flight reaction. Are you always in state of hyperdrive? That, in fact, can impact digestion. The nausea that you feel, that doesn't have to be a disease process. It could be a stress pattern. And we talked about the diarrhea and the constipation and so forth. So the two brains that we've been talking about, this enteric nervous system, if you will, the gut, and our big brain, the one between your ears. Irritation in the gut can send signals to the central nervous system, up to the big brain. And when it does that, that's where the mood changes come from. That's where the that negative feedback takes place, that irritable bowel pattern. So when you have somebody who has an irritable bowel long-standing, you can almost guarantee that they have problems with anxiety or depression or something in between that. And it's not about giving antidepressants. It's about fixing the underlying problem. On the 10th, I'm going to get in that really deeply. I'm going to show you the pieces of the puzzle that make a difference. You know, people ask me, well, how can I start? How can I start fixing my gut? How can I, if that's really true, what can I do about it? There's several things that you can do. You know, there's some studies out right now that that the detoxification process within the intestinal tract can be assisted by hydrogenated water. It begins to detox things. When I first ran into this a while back, I was at a seminar and there was a vendor there from Echo Hydrogen Water Company. And he said, hey, have you tried our water yet? I said, no, I haven't tried it yet. And so he said, here. So he filled up my container, and I'm always drinking water like this. And so I started sipping on it, sipping on it, sipping on it. Within about 20 minutes, I had a headache. And I had eaten pretty well the night before. Went out, I had fish, I had some vegetables, I had, like I usually eat, I had a glass of wine with dinner. I said, glass of wine? I don't drink that often. I shouldn't be experiencing this. So I went over to the guy and I said, hey, what's in this water? And he told me, you know, I'm drinking hydrogen water. And I said, it really detoxifies that quickly. He smiled at me and he said, yes, it does. And I said, wow. So we started using it. We started buying small containers that we bought a whole house hydrogen filter that's on our sink. So anything that we drink at the house, we try to do that with. And I put it on my website, and I got a great deal for you guys. If you go to drtomroselle.com, you're going to find a hydrogen filter there, and it's like super cool. We got it there specifically for you. Now, another step is to clear your diet. Go to a low-stress diet. Clean organic vegetables, low-residue organic grass-fed free-range meats, nothing that's been adulterated. Get rid of the grains, and then start drinking bone broth in between your meals or as a substitution for your meals with maybe a little bit of chicken soup. So there's a bone broth that I really like, and it's called Kellyanne's bone broth, and that's on our website as well. Go to drtomroselle.com and you'll find it there. It's really excellent. That's the one that I use at the house, and that we tell our patients, if you're going to go get one, get that. It works great. So those are two pieces that you can start with. I think that you're going to be really, really happy with them. And the third piece, because you've got to heal the intestinal lining, is glutathione. And with glutathione, you have to either do it IV intravenously, you can use a suppository, or you use it with a liquid, which is an ionizable, rapidly absorbing glutathione. We have that for you as well. So check it out, all three of those. It's a good place to start. Now, there's a lot of other things. If you have mold and fungus that's in your system that can be causing all kinds of problems, what I would encourage you to do is stop anything that feeds it. So what feeds mold? Dairy products of any kind. Yeah, I know. I just took away everybody's diet. Peanuts and peanut butter, alcohol, fruit juices. If you're going to have fruit, organic blueberries or blackberries in small amounts once a day. You've got to starve it. So start with that. And you'll find that that will begin the process. Now, here's what I want to remind you is that when you do start a gentle, even a small, gentle detoxification process, the first couple, 2-3 days, you're going to feel a little sluggish. Make sure you're drinking lots of water. Make sure, and if you can't handle the hydrogen water, make sure you're getting good, clean, filtered water. And the rule is generally your body weight divided by 2 is the number of ounces of water that you should be shooting for every day. Get rid of the coffee because you're getting toxic with that. So there's ways of making this happen. On the 10th, I promise you, I'm going to walk you through it. But more importantly, I'm going to show you the real effects and how it takes place. I'm going to show you the pain patterns that it causes. But today we're talking about that anxiety pattern. We're talking about the depression you go into, the reactions that you don't want to have. It's all about this. It's really straight up. So please join me. Make sure you understand that. And I want to remind you again, on Women's Day at the Roselle Center in Fairfax is July 21st. I wouldn't miss this if I were you. I think it's going to be a really amazing, fun day. It's a Sunday. You're really going to enjoy this. And unfortunately, I can't even show up by accident. They told me, you can't come in. We don't want you anywhere around the place, but you got some amazing people that are going to really give you insights. Ladies, this is the day for you. Guys, you can't come. You got to stay home. Ladies, this is just for you. It's our gift to you, and I promise you, you'll have a great day. It'll be a lot of fun. It's going to be an enjoyable time for you. And then on the 10th, which is coming up around the corner, join me. Come to the Roselle Center in Fairfax. Make sure you register for both of these classes. And I promise you that I'm going to get into the intimacies of some of the things that we do and things that you may never heard of before and that you can apply accordingly. So join me. It's going to be a lot of fun. And remember that this is a program that I put together for you. Ageless Health is for you. Ageless Health is the moniker I've used for the classes that I teach the lay public. It's the moniker for my book that I wrote years ago. It's called Ageless Health. Health is a do-it-yourself program, the name of this program. So all of these things come together because your body should be under your control, under your direction, and nothing else. I'll see you again next week. Join me on the 10th. Join us on the 21st. And remember, I do this ongoingly for one reason only. I love you all. Have a great day.